our series 10 talks, short talks, big ideas shared locally. We've reshaped our 10 talks for 2026 and joined by our fabulous colleagues in Greater Manchester and Lancs and South Cumbria. All episodes will be recorded and can be found on your Training Hub website. So sit back, relax, turn off your cameras, turn off your microphones, and think of any questions that you've got during the talk. Put them in the chat and we'll get them after the recording stops. So welcome to Rooted in Healthcare, Greener Practice and Wellbeing. We're joined by two fantastic people. They're both social prescribing link workers. Trish works in Bolton with a background in substance misuse and mental health services. Trish develops opportunities for people to engage with nature, outdoor activities, all to help them on their health and wellbeing journey. And Margaret works with Charlie Rhodes PCM with many years of experience across healthcare and clinical settings, knowledge around community outreach, engagement, signposting, it goes on the list, supporting both individuals and communities to strengthen those connections between primary care and the voluntary sector. So today we're going to be looking and listening around practical examples of how green social prescribing is really making a difference. So welcome, Margaret, and welcome, Trish.
Hello, and thanks for having us.
Absolutely. So tell me, first question, why were you drawn to greener practice?
Well, I guess from my point of view, I've always been drawn to green spaces. I find them a very therapeutic and calming space to be in. But during COVID, I really noticed a massive leap in people experiencing loneliness and isolation. In and out of lockdown and fearful of meeting up with family and friends, let alone strangers. And so it was just a chance meeting with somebody from the Woodland Trust in a COVID vaccine clinic. I was the runner, she was managing, and we just bumped into each other, had a little bit of chat, and we decided that we would develop our first green prescribing for this network, which was our tranquility walks. I mean, it was a safe distance, outdoor space for people to meet, spend time in nature, and I noticed the benefits straight away. So people became more relaxed, and people opened up about their struggles in a non-clinical setting.
Yeah, it was so powerful that we had like 1 hour, were we allowed, I think, at the time of exercise? I can't quite remember the COVID days. I think I must have liked them out, but I mean, it was so precious, wasn't it, that time?
Yeah.
So if I was to do something in terms of improving my own emotional or well-being, health, what's one small green kind of change that I could do to do that, to improve my health and well-being?
Well, we had a chat before, and we always refer back to having a mindful pause. We're all really preciously under pressure. Time is really precious, increasing workloads, but it's really important for ourselves as health practitioners to take a moment of time, and that can be 30 to 60 seconds even. Just lock yourself in a cupboard, deep breaths, have a bit of time for yourself, put the engage sign on the door. This has been shown to really improve and help prevent burnout by letting the brain reset, improve staff focus, grounds you physically, and creates a sense of good enough in stressful environments. Because we quite often go from one stressful event to the next, don't we? We're not giving ourselves a pause in between. Even if you go and lock yourself in the room, just have 10 or 20 deep breaths. Give yourself time to refocus and reset, and then come back out. And ideally, we'd say 15 to 20 minutes, but we know that's not always practical.
Yeah, and as you say, something is better than nothing, isn't it? Especially if you can fit it in with your day. If you are going for a toilet break, give yourself, 60 seconds extra and just kind of calm the nervous system down. So have you seen that actually work in practice? Have you seen people doing that yourself?
Yeah, so we're really sort of keen on promoting a greener way of being, or just a more mindful way of being, and we always encourage the use of communal spaces within the PCN. So, you know, somewhere to have a 15-minute coffee break. No, it's a no work area. If you want to go super green, we're swapping out your plastic water cups for reusable glass cups, that sort of thing. And it also, you know, when you work it, especially if you work in GP surgeries, everybody goes in and then the door, you just all go into separate rooms and shut the doors, don't you? And then you don't see anybody all day. So it's really important to kind of create those community settings that you can come out, sit down, have a chat with your colleagues. We do also hold walk and talk meetings as well with a lot of the services that we collaborate with. So instead of all getting in a hot office, no air, no windows, we try and encourage people to come to the meetings, and we just walk and talk.
That's really important. So in you know, thinking about that first, isn't it? So when you're organising a meeting or you're organising something else, rather than doing a Teams call, why not make it a phone call where you could all walk around? You know, I think it is your mindset, isn't it, then, and trying new things. When it may work, it may not.
Yeah, exactly. And obviously establish some green social prescribers in your PCN.
Yeah, to encourage this, right?
Staff and patients.
No, but you're right. You know, if it's being led by people, people are more likely to adopt it. So what's the easiest kind of green win that a really busy practice could start today, tomorrow? What would you recommend?
So a green busy practice could start with simple visual actions. So it could be a nature and wellbeing notice board, you know, with local walks and groups, or could encourage active travel. So you could circle to work, yeah, or walk to work. The other one is maybe switching one meeting each week to a walking meeting. Reduce unnecessary printing. So the key is really here is not perfection, it is momentum. So yeah, a busy practice do not need a massive sustainability strategy to you know, overnight. But small constant actions create culture change over time. So say if staff says, oh, this feels manageable, then it's more likely to last.
Love that. What was you say? It's not something, it's momentum. What was that that you quoted?
It's not perfect.
It's not
perfection. It's not perfection.
I'm gonna nick that. I'm gonna quote you, Margaret, every time I say it.
It's so the other thing is what the other really quick win as well is promoting people to return their used inhalers to local pharmacies. That's a massive green win that you can do. Requires virtually no staff, but yields a massive carbon reduction because of the escaping propellants thrown away, can have highly potent greenhouse gases. There is a really good GP practice wellbeing kit which you can register for free, and it's called the Green Impact for Health Toolkit, and that is created via the Greener Practice Network, and it offers ready-made step-by-step framework that saves time, cuts bills, and boasts team morale. So it's a really good network to sign up to.
That's cool. So, you know, all that climate change conversation, really, it's about also making us feel better in work, isn't it? So that's great. And we'll definitely share that link, though, on our website as well, and we'll make sure people have got that. So, you know, we're talking about climate conversations. Sometimes they can feel really overwhelming. How do we start those conversations to make people feel empowered? So instead of being overwhelmed, you know, like that momentum, not perfection.
Yeah, so stay positive, you know, focus on what people can do, not make them feel guilty, because most people already care. All they need is encouragement and realistic next steps. So helpful climate conversation around connect to health and well-being. We could celebrate progress. We could stay local and relatable, and empathise on collective action rather than individual perfection.
Yeah, what we've done ourselves.
Yeah.
That sounds like great advice.
Yeah, and the other thing is, hope grows when people feel connected and useful and part of something positive. So going to nature itself teaches us that. So small things grow slowly together.
Lovely. You're full of these quotes today, Margaret. Honestly, I'm really nicking them. So we've done our 10 minutes, but what will you say is the one thing that we need to remember from today's talk before we jump into our questions?
So any change, no matter how small, that's a change nonetheless. So small actionable steps soon add up, and you may be pleasantly surprised of others' enthusiasm, creativity, and ideas. And it's about being part of a solution. There's lots of little things you can do, those mindful moments, putting a bench or planting a tree outside your surgeries, having somewhere for staff and patients to sit and reflect. Get involved on a bigger scale. We're off to do a balsam bash this evening. I don't know if anyone knows, but yeah, Himalayan balsam, massive invasive species. So there's lots. If you start looking in your local networks, connect to your local nature groups, your local community gardens. There's loads of little things going on that you can connect to those people. And just do those steps.
The other thing is, we're talking about nature here and health. I just want to mention, I think it is really important. Health and nature are deeply connected. So if we do look after our environment, we also look after people's physical and well-being. So yeah.
Absolutely, it goes hand in hand. Well, thank you both. We're going to stop recording there and we're going to take some questions. So I was